Pregnant women in Ontario are undergoing more ultrasounds than recommended by Health Canada guidelines. That is according to a study released today in the Canadian Medical Association Journal. Terry Reith is in Edmonton with more on what this means for women and the healthcare system as well. First of all, Terry, can you give me some details about what this study found?
Yeah, sure, Suhana. This team of researchers at McMaster University were concerned about the use of diagnostic tests. So they chose ultrasound as one example, and they looked at ultrasound tests on women in Ontario over a 10-year period, found a 55% increase. Now, the current guidelines recommend 2 ultrasounds during a normal pregnancy. One would be done in the first trimester, one would be done in the second trimester. When the researchers took a look at it, they found most of this large increase was happening with tests that were being done in the second and third trimester. In fact, 20% of the women that they looked at were getting 4 or more of these tests. Now, you talk to women and they will say, well, we get these tests, this is reassurance. We have 5 fingers, we have 5 toes, this is good. But the researchers have a bit of a different take on it. They suggest that this is being really overused. In fact, they suggest that some families are using this strictly for the entertainment value of seeing the fetus. And what they've calculated is that over the decade, the additional ultrasounds that were done cost Ontario taxpayers about $30 million.
I was just going to ask you to put a price tag in terms of cost to the healthcare system, but that's quite a bit of money.
That is quite a bit of money, but that's a drop in the bucket, according to these researchers, when you look at Canada overall and the number of diagnostic procedures, because remember, they came in with the thesis that ultrasound is just one example. We've got MRI, CT scans, PET scans, the whole gambit, and these all come up to about $2.2 billion a year. So the suggestion coming out of this paper, using ultrasound as the example, is that if we put slightly stricter controls on how we're doing these tests that are designed for high-risk populations, more often being used now in low-risk populations simply for that reassurance, we could save an awful lot of money.
Are there any dangers that you've discovered, Terry, to mother or child having more ultrasounds than Health Canada guidelines recommend?
Well, the paper took a look at that, and there's nothing really definitive there. They suggest that perhaps there might be some problems with getting too many ultrasounds, but they're not really specific on that, and that's some research that they're going to have to take a closer look at.
Okay. Thank you so much for that, Terry. That's CBC's Terry Reith in Edmonton.